As baby boomers age, they're experiencing more aches and pains, and some are resulting in surgery to replace worn-out parts. There have even been advances in treatment for hip replacement. And this afternoon, Dr. Edgar Handel of Boca Raton Regional Hospital joins us to tell us more about that. Thank you so much for joining us, first of all, Doctor.
Thank you, Mike.
We're talking specifically about the anterior approach of hip replacement. Talk to that.
Well, the anterior approach is really the technique I use is called the direct anterior approach. There are other anterior approaches that are not equal to this approach, and that needs to be clear.
Okay.
The direct anterior approach is an approach that involves replacing the hip without cutting any muscles or tendons. There is a certain anatomical plane in the front of the thigh that we can get into the hip joint without disturbing any of the muscles or tendons. All we do is spread them. It's like going through the front door of the house. We're going through the front door of the hip, not the back door. The older techniques involve, and any other really technique that's available for hip replacement, whether it's mini incision or traditional incision, involves cutting muscles or tendons that are important in stabilizing the hip joint. The beauty of the direct anterior approach is that because you don't cut any of these vital structures, the hip is immediately stable and ready to walk on within hours post-operatively, with no need for healing or muscles or tendons. The only thing that really needs to heal is the skin incision.
I see, and we have a little visual representation of it there. You can see the hip, and
yes, that's the hip joint with a ball in the socket.
Okay.
That are replaced.
Would all hip replacement surgeries be eligible for the hip replacement surgery that you just talked about, the direct anterior approach?
Well, that's a great question. Basically, so far, all comers I've done through the direct